Health authorities across Latin America are battling a rise in coronavirus infections. The region already has the highest COVID-19 death rate in the world. Brazil has suffered the most fatalities in the region, with more than 500,000 deaths. That's followed by Mexico, where over 230,000 people have died, and Peru has reported nearly 200,000 deaths. DW's Johan Ramirez reports from Lima, where the new lambda variant is pushing the public healthcare system to breaking point.
In Peru, people are placing their hopes for curbing the pandemic on vaccination. Yet, progress is slow. Only some 15% of Peruvians have received at least one dose, one of the worst rates in Latin America. But for health workers on the ground, it's better than nothing. We feel optimistic because people react well to vaccination in Peru. In fact, younger people would like everything to go faster so they can get vaccinated soon. Although commerce has reopened after a 9-month quarantine, strict safety measures remain in place. Authorities have mandated using double face masks to enter stores and shopping centers. Face shields are widely used, and hand-washing facilities have been installed in the streets. But it has not been enough. Peru has the highest per capita death rate in the world. The government's response to the crisis has been widely criticized. The doses arrived too late. The management of the pandemic is a complete disgrace, especially for the previous president's one. Now at least the Pfizer vaccine has arrived. The last 2 peaks of infections in Peru have coincided with deep political crises that, in both cases, led to massive demonstrations. The first one was in November, when political instability led to 3 presidents in 1 week.
The second wave of protests is happening right now. The reason? A controversial presidential election. One of the candidates cried fraud, while the other claimed there is a plan to steal his victory. Supporters from both sides have taken to the streets. According to some experts, these demonstrations could cause a further rise in the infection curve.
But at this point, the country cannot afford new lockdowns. The greatest effort must be done to vaccinate the population and to start negotiating from now on new generation vaccines for the new variants that may appear. This is the most effective measure, and we have been slow in doing so. On average, Peru administers about 350,000 vaccines every week, a low figure for a country of more than 33 million. Authorities have promised that the process will accelerate. A government forecast estimates that the eligible population will be immunized by the end of 2021.
Cuba is expected to approve one of its vaccines against COVID-19 in the coming days. Regulatory approval for the shot, called Abdala, could help speed up vaccinations across Latin America, where the case numbers remain high. But countries are struggling to get shots. However, public health officials are calling for caution, saying the vaccine should be scrutinized by global drug regulators before being used around the world.
A moment of celebration in Havana last month as Cuban scientists announced the results of their COVID-19 vaccine trial. The shot's 92% reported efficacy rate puts it in the same league as those developed by pharma giants like the BioNTech-Pfizer alliance. A remarkable achievement for a tiny island of 11 million people. Havana has 5 COVID-19 vaccine candidates in development. It's been vaccinating its own citizens since May, and last month started shipping shots to Venezuela, a point of national pride. We Cubans help others, things that other countries in the world don't do, countries that have more possibilities than we do. And we help those in need without any problem. Cuba says 30 countries have expressed interest in its vaccines. But public health officials and even politicians are urging caution. Cuba's state biotech firm hasn't published trial data yet or applied for approval from the World Health Organization. If this vaccine is approved by the international scientific community, we will welcome it. But it must be approved. We Venezuelans should not be guinea pigs.
Conejillos de Indias.
But with no end in sight for Latin America's vaccine shortage, some are being forced to choose between an unrecognized shot or none at all.